Hi, everybody. Dr. Kevin Passero here. Just want to take a couple minutes in this video to teach you two things that you probably didn't know about your heart and circulatory system that I think are really interesting. Number one, your body contains over 60,000 miles of blood vessels. That's enough to circumvent the entire globe 2.5 times. So even someone who's only 5 foot tall and weighs 95 pounds, they have enough blood vessels to go around the entire world twice. Now, the reason why that is, it's not just the large vessels that we're looking at that create all of that length. It's the surface area that really creates all that length. And that has to do with how our blood vessels get smaller and smaller and smaller and terminate in something that are called capillary beds, which we're going to talk about as the important part where oxygen and nutrients are diffused into the cells and waste products and carbon dioxide are picked up. Now, the second interesting fact that we're going to talk about, which relates to the circulatory system intimately, has to do with the fact that what's good for your heart is good for your brain. Have you ever heard that? Some people may have an idea that they're connected. They get nervous, they get stressed emotionally or mentally, and their heart races. But that's not what I'm talking about. I'm talking about the fact that most leading cardiologists and neurologists agree that the factors that lead to good longevity when it comes to heart health are the same factors that are associated with good longevity for brain health, meaning lower risk of dementia and lower risk of cognitive decline as we age. And this all comes back to what we were just talking about, the blood vessels in the capillary beds. Because heart disease and heart attack is what happens when the large vessels that feed blood to the heart muscle over time get clogged with plaque. And the vessel gets clogged, the blood can't flow, the heart muscle can't get oxygen or nutrients, and it dies. That's a heart attack. Now, the brain doesn't have just 4 or 5 really large vessels feeding it. The brain has a vast network of these smaller microvasculature, these capillary beds that feed the brain cells the oxygen and nutrients they need. In fact, it's estimated our brain has over 600 miles of capillary beds just up here, which is pretty phenomenal to think about considering our brain only accounts for about 2% of our body weight, but consumes about 30% of the energy in our entire body. So it needs this vast network of these capillary beds because as the blood vessels get smaller and smaller and smaller and smaller, to the really large ones you can maybe see in the inside of your elbow, to the little capillaries or arterioles, which are smaller than thinner than a human hair, when they get that thin, the structure of the artery wall changes and it allows the oxygen and the nutrients to just passively diffuse right across the wall and the membrane of the arteriole and allows the carbon dioxide, which is the waste gas, and the other waste nutrients to diffuse across into the venules, which then terminate in the big, large veins, which then dump into our body and help to the organs for excretion. So these tiny little capillary beds get damaged by the same factors that damage the large vessels of our heart. The three most important ones, the three factors that we know are the most damaging are high cholesterol, high blood pressure, and high blood sugar. Now, there's a lot of other factors in chronic inflammation, infection, heavy metal toxicity. There's many other factors that lead to damage to your blood vessels, but those are the top three. And not only do they damage, which we know as a scientific fact, a medical fact, not only do they damage the arteries of the heart over time to cause a heart attack, but when we study their effect on these arterioles in these capillary beds, they damage them as well. And what happens is instead of having these vast capillary bed networks where we've got hundreds of little arterioles and hundreds of little venules meeting in an area for all the surface area of oxygen and nutrients to diffuse, you end up with less because the arterioles start to die and they start to get resorbed by the body. And the less surface area that you have of these capillary beds, the less oxygen and less nutrients can diffuse into the cells, and the less carbon dioxide and less waste can get reabsorbed back into the venules. So this is why it's incredibly important to understand that the patterns that you want to change regarding to your eating habits, your lifestyle habits, your supplementation, your pharmaceutical therapy that may be benefiting your heart are critically important to also supporting your brain. We think of dementia as this big question mark. We know that heart disease is primarily preventable through lifestyle and diet. That's been proven in the medical literature. dementia has this big question mark. What can we do to avoid losing our minds as we get older? Well, like I said, most cardiologists and top neurologists will agree that the dietary, lifestyle patterns, and other types of patterns that you engage in that reduce your risk of heart disease, lowering your blood pressure, lowering your blood cholesterol levels, lowering your blood sugar, optimizing those, are critically important for also supporting your brain and neurological function as you get older. So I thought those were really two interesting facts that most people don't know about their heart and circulatory system. How many blood vessels you have in your body is absolutely fascinating. And taking care of those blood vessels is a critically important step to not only preventing heart disease and heart damage as we get older, which is the #1 killer of all Americans, but also preventing the cognitive declines associated with aging and keeping our brains mentally sharp and focused as we get older. So thanks for listening. I hope that was helpful. I look forward to talking to you in the next video.